Hello and welcome to our allergy broadcast. We go live on Facebook about once a week. Our videos are also a part of our YouTube channel, so feel free to subscribe there as well. During our live broadcast on May 26, 2018, Laura had a question regarding the use of allergy medications. Um, Allergy medications can be divided in general into two groups, either the oral antihistamines or the nose sprays. The oral antihistamines can be plain antihistamines like Benadryl, Zyrtec, Allegra, or Claritin, or they can also have a decongestant component. They can be plain Sudafed, like plain decongestant like Sudafed, or they can also be a combination of antihistamine and decongestants. And generally, you can tell that by the modifications to their name to include the D at the end. So it's Allegra D, Zyrtec D, Claritin D, or the generic form of that. Decongestants can give you relief of congestion. So people tend to like them, but also you need to be aware that they have potential side effects and they carry a risk of increased blood pressure and increased risk of stroke in some patients. They also can cause increased headaches, anxiety, and insomnia. So if you're having trouble sleeping, taking decongestants may not be the best option. Nose sprays also can be a form of decongestants. If we're talking about Afrin or uh, other generics that are used for quick relief, um, those are commonly effective for congestion during a cold and would be appropriate to use for a short period of time that does not exceed about 3 to 5 days or so. Going beyond that, you carry the risk of becoming dependent to those decongestants, which means that every time you try to stop them, you'll end up worse than you started. So there'll be some difficulty in coming off those if you stay on them beyond the period of 5 days or so. They can also cause some damage to the nasal tissues if they are used on a long term basis. You may end up with perforation in the nasal septum as well, which can be difficult to treat at times. Now, nasal corticosteroids, on the other hand, are a very effective way to treat allergies. They do not work right away. They take about 3 to 5 days to achieve full effects and have to be used consistently. So, using them as needed, you're not going to get the relief that you're seeking. Um, Although they are corticosteroids, they generally are safe and don't have the same risk as oral or injectable corticosteroids, um, provided they're using within the recommended dosage of once or twice a day at the most. They can be also very effective if started before the beginning of the allergy season. Some studies show them to be better in controlling allergy symptoms if you start them within few weeks before allergy season starts. There are other forms of nose sprays, and those can be antihistamines or others like nasochrome that can also offer uh, some relief for those patients. Of course, allergy medications come also as no, eye drops. Again, antihistamines and decongestants are generally the two classes of those eye drops. You will not find uh, steroid-based eye drops over the counter. Um, there is a slight risk for with use of steroid eye drops or steroid nose sprays, and increased risk of cataracts and glaucoma. So, if you're having eye issues, and that applies especially to Laura or people with eye issues, that use of anything with decongestants or with corticosteroids needs to be used carefully. Um, Of course, other than these classes of medications, in the last few years, we've had other options like tablets for treating grass pollen and ragweed allergies. Again, talk to your doctor or your allergist if those are not a good option for you. Um, the final option is allergy shots or allergy immunotherapy, which we have used over the last 20 years and has been used by many allergists over the last 100 years or so with good results. Allergy shots have more than 90% effectiveness when it comes to pollen allergies. They have 70 to 80% effectiveness when it comes to mold and dust mites. They are also very effective when it comes to pet allergy like cats and dogs. So there is no uh, best treatment for allergies. There's no one treatment for allergies. It depends on what type of allergies you have, the severities, your other medical conditions. Um, Again, all of those, if you're not achieving the results that you like using over the counter medications, then it may be a good idea to discuss this with your doctor or your allergist. So I hope this answers Laura's question, and I'm sure many of allergy sufferers that always have issues or concerns about which medications to use. This is Dr. Safadi, Allergy Clinic Ohio, wishing you a wonderful week ahead. Remember, you can always follow us on Facebook. If you go to this post, you will be able to type number 7 in the comments, which allows us to send you notifications in the future when we go live to discuss allergy issues. Um, Wishing you all the best. Thank you.